Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Today, I am joined by Dr. Yeung for eye health and whole person wellness to our local community through her new practice, Peak to Peak Vision and Boutique. After years of providing expert care in the Boulder area, she's now serving the Erie and Lafayette areas, a dream that she's had for. Dr. Yeung, welcome to the Erie Wellness Podcast. I'm so glad to have you here. How long have you lived in Erie?
Yeah, thank you for having me, Lauren. I've really admired your passion with this podcast and just reminding everyone that wellness goes beyond just our health, and talking about financial wellness and creativity as well. So I've really enjoyed what you're doing here.
Oh, thank you.
Yeah, so I've lived in Erie coming up 10 years now, and it's been amazing, like seeing that growth.
Yeah, it's just wild how much our town has changed over the past few years. It sounds like we both moved into the area. I was 2015. You as well?
Yeah, pretty well, like very beginning of 2016.
Okay. When we first moved in, we would go to farmers markets or local community events like Erie Biscuit Day, and I would recognize a lot of the same families. And now I'll show up to the farmers market and just be like, I don't know a lot of these people. Our town is definitely growing for sure.
Right.
Do you feel like you've noticed some changes as well in even like kids' activities?
Yeah, definitely. Like, signing up for soccer is insane, but it's still nice. Like when you show up, there's still always people you run into that you haven't seen in a while. So yeah, it does feel like it's gotten a lot bigger and there's a lot more people, but I still run into people all the time, which is still nice.
Yes, I know. With our daughter's group, it was like, oh yeah, you're in Erie too. So
Yeah.
But okay, so can you tell us a little bit about your story and how did you get into optometry?
Yeah, so I've worn glasses since I was in second grade, but that really wasn't my driving force into optometry. When I was in college and seeking out my career options, I kept doing those aptitude tests and I kept landing rehabilitative medicine, so like PT and OT. And while I admire those professions and work closely with them, I just didn't really feel called in that area. And so my mother encouraged me to talk to my optometrist, and I told her how I really liked working with kids and just really wanting to see people thrive and bring whole wellness to them. And she introduced me to vision therapy. She was like, hey, there's this area called vision therapy. I'm not sure how I feel about it, but it might interest you. So in my whole hometown, there was only one vision therapy office. And so I went and I shadowed. And it was just so rewarding seeing kids come into the office that, weren't doing well in school. They couldn't read. Their self-esteem was so poor because they felt like they couldn't learn. And just them being able to complete a program and come up thriving in school and just really happy. The office would give them a gift card where they can choose between like a movie theater, a toy store, or a bookstore. And these kids that came in not wanting to read all chose the bookstore gift card. And just to see all these like lives and opportunities open was so rewarding. I just knew I wanted to be part of it.
Yeah, I mean, it's life-changing for a kid who can't read and doesn't feel confident in school to actually being able to read, and confidence then shows up in all areas of your life. And you grew up in Canada, right?
I did, yes. Edmonton, Alberta. So, the size of the city itself is pretty similar to like Denver proper. And then we have very similar climates. Yeah.
Okay. And so where did you go to undergrad?
I went to undergraduate school in Canada and then went to Pacific University for optometry school. And that's where I met my husband.
So Oregon. So kind of all similar climates then.
Pretty similar. Yeah.
All the seasons and whatnot.
Yes.
So one thing that when we were doing our initial call and just I wanted to hear, what did you want to share with our Erie listeners? Was you wanted to talk a little bit about binocular vision disorder. For those of us who don't know what that is, can you explain it in simple terms so that we understand it?
Absolutely. So binocular vision is just our ability to use our two eyes And together with our brain, make sense of what we're seeing and understanding our environment so that we can respond to the world accordingly,
Mm-hmm.
right? So for someone whose binocular vision isn't working well, it can really disrupt how they're interacting with their world. In more extreme cases, you have strabismus, which is an eye turn either inwards or outwards. Sometimes it can be vertical as well, or amblyopia. And the common term for amblyopia is lazy eye. I don't like that term because it just kind of puts a label on an eye.
Mm-hmm.
Um, However, it just means that your two eyes aren't working equally and together.
So how would you know that you do have binocular vision disorder?
Yeah,
Even if, like, say you didn't have what's called a lazy eye, what are some other
right.
symptoms that you'd notice?
Definitely. So binocular vision disorder is definitely a spectrum. And so, you can have different levels of it. Different symptoms that you may have in more severe cases, you may have double vision, but you can also just have difficulty reading or tracking. So if you're
Mhm.
skipping lines a lot or skipping small words, that could be a sign of binocular vision disorder or tracking issues. But also, some people can have like dizziness, car sickness,
Mm.
and or sometimes when you're like reading, things may like look 3D or look like they're floating off the page. If you're
Mhm.
focusing on something and it's not moving, but it feels like it's shifting in space, that could also be a form of binocular vision disorder.
Is it something that can progress? Say you didn't really notice it in school, but now you're noticing some of those other symptoms in adulthood. Does it progress?
Absolutely. So I would say like the level of stress or the demands that you have visually can definitely cause the symptoms to get worse.
Mhm.
And then also if it's not, addressed and your body's trying to compensate for too long, you can develop those more severe cases. So I have seen like eye turns develop a little bit later and it starts like infrequent only when you're tired and it may get worse and worse.
Are there certain signs parents in particular should be paying attention to with their kids?
Yeah. So Dr. Rohr kind of mentioned a lot about like reading and vision in general and learning.
Mhm.
But I would say like anytime definitely kids are struggling with reading, if they're skipping lines or words a lot, or even like mixing the letters up as they're sounding out words, it
Mhm.
could be a sign that, the eyes are seeing two different images and the brain's trying to like switch between which image to look at. And so it may be like completely skipping words, or like I said, even like just the letters switching places could just show like a mild mismatch in how they're looking.
Mhm.
Um, Even in sports, if kids are in sports and they're kicking or hitting constantly early or late, that could be a sign that they're not processing where the ball is accurately.
Mhm.
If they're really clumsy or even like hesitant to try new things or climb, they're just very cautious. That could also be a sign that they're processing their world inaccurately.
So what are some treatments that might be able to help them, get back to where both eyes are working together nicely?
Yeah. So the nice thing about vision being learned is that these are all skills that we learn and develop through early life. And because they are skills that are learned, we can teach it to somebody too. So vision therapy involves a lot of exercises and just experiences that we normally experience, but we're just using those common experiences to teach the eyes and the brain to work better together.
And our eyes are muscles too, right?
They
So, like,
are, yeah.
muscle memory helps, I'm sure, a lot as well.
Absolutely, a lot of practice and just teaching the brain that there's a different and better way of seeing than how it is currently doing. Yeah.
Okay, that makes sense. Then in terms of vision therapy, like, how long does it take? Especially if someone's coming in and wanting to work with you, is it a once a week thing? Do you give them,
Yeah.
like, take home exercises? What does all that look like?
So, vision therapy is very beneficial, and it really varies depending on how many skills we have to teach. I don't offer the weekly therapy sessions. There are two very great offices here already, and these providers speak around the world. They're very well known. I'm here trying to bridge the gap a little bit. So either for like kids or families that aren't ready to make that weekly commitment yet, I'm
Mhm.
here to just kind of give them something to, still work them towards improvement while they're waiting to get into a program, or if they've been in a program and they've mostly met most of the goals and there's just a couple things to work on, I'm going to have some like group sessions where, kids can work together to like just build on these final skills to, propel them to the next level.
Mm-hmm. Are some of these group therapies, is it expensive?
So the goal of the group therapy is to make it less expensive. So we want it to be affordable and to be like a shorter session, so it's not feeling like so overwhelming.
Okay.
However, because they are in a group, you're not getting that into like the very personalized therapy.
Mm-hmm.
And so that's the biggest difference.
Okay. But if you're someone who isn't ready for quite the commitment or
Mhm.
maybe isn't ready to pay for something like that, you could certainly start with it and just see what kind of progress your child makes, right?
Absolutely, yeah.
Okay. Okay. So you also work with patients who have dealt with brain injuries. Can
Mhm.
you share what that looks like?
Yeah, so this is my rehabilitative side that, I was, scoring really high on.
Yeah, your PT side.
Right, yeah. So a lot of brain injury patients after their brain injury and sometimes for years afterwards, you know, everything looks fine. Their CT scan, MRI, everything looks great. So they're just being told, there's nothing wrong. Just learn to live with it, push through, and they're just not getting better. And
Mhm,
so what we can do is a lot of times the glasses prescription that a brain injury patient needs is a little bit different than exactly what we measure in the machines. And
mhm,
so having that knowledge and making sure that the brain and the eyes are working the best with the prescription is our number one goal. Sometimes having the clearest vision is almost too high def for the brain injured patient. So I
mhm,
tell patients who have suffered from a brain injury is like their body is kind of stuck in fight or flight and they're just waiting for the next trauma to hit. And so, because they're always so hyper aware and hypersensitive, having too much visual information is overwhelming to them. And that's what causes their fatigue and headaches and dizziness, things like that. A lot of times, these patients, they can't go to a grocery store during normal hours because there's just too much stimulation. And
mhm.
so, finding the right prescription for them. We also use light therapy. We use these colored filters that help calm the nervous system down. And the other thing it also does, and I think we'll mention it a little bit later too, is that it just opens up their functional fields. And then the last thing, once they're well enough, they can go back and do vision therapy and really retrain those visual skills so that they're more efficient again.
Okay. Is this something that a normal doctor, like ER doctor would mention to you after having a concussion and being like in the urgent care? Or is it something, because I didn't even think about going and having your eyes checked out, after a
Right.
concussion.
So unfortunately, I don't think that a lot of ER doctors understand like what we can do as optometrists. And I
Mhm,
think it's also a little bit challenging because not every optometrist is well versed in this area. And so if they're just focused on giving you the best glasses, making sure you're seeing 20/20, they may not know to refer you to their colleagues that are more well versed in these areas. And
mhm.
um, there's actually a study that just came out that says that starting vision therapy early on post concussion actually improves your rehabilitative care and things like that. So that
Mm.
research is really coming out. But
Mhm,
vision therapy's been around for years, and it's nice that it's finally getting some recognition for what it can do for patients.
mhm. What are some, brain injury patients that you've seen? Like, is it concussions playing sports? Is it, even kids? Is it,
Mhm.
car accidents? Like, what are some
Yeah, we see
examples?
all kinds. The things with brain injuries is that they're cumulative, right? So you may have had maybe two or three concussions from sports, and then just a very mild bump to your head on the cabinet can really trigger some of these symptoms again because
Mhm.
they are so cumulative. Even for myself, one time I hit my head on my daughter's bed and I had to like go drive somewhere. I was shocked at how quickly I felt like focusing on the road and just the nausea that I felt driving was pretty severe. And
Mhm.
I knew it was just from that bump to the head because I've worked with these patients that have complained about these symptoms. But I
Mhm.
can also see how they get brushed off very easily. And it's
Right.
just my heart for them that, they've suffered for so many months or years. and to give them that hope again. It's amazing.
Well, and some people might just be like, well, I just need to be taking like some pain med, to like, I
Yeah,
just had a concussion, so it's okay. I need to just be taking like my pain meds to get rid of, that. But then what's the root cause underneath it all, right? And
right,
what's
right.
going to manifest like years down the road after you've just kind of masked the issue for a long time.
Exactly.
So is this vision therapy that you use with brain injury patients, is this a very similar vision therapy that would use someone that has like binocular vision therapy or disorder?
So with vision therapy, we're really just like looking at what skills need to be rehabilitated. So I tell people, when you've had an injury, it's like taking a ball of wire and throwing it against the wall. No matter what, it's going to get tangled. And so
Mhm.
your brain's trying to build these new connections to do those skills again. However, because we're not learning it at a very basic level like we are as babies, where we're like crawling and things like that, we have to like build these very complex connections that are often redundant and not the most efficient. And so, what vision therapy does is we bring it kind of back to that basic level to reteach those skills so that they can be more efficient.
Mhm.
So, what's different with what I do is a lot of times for more severe head injury patients, they are so symptomatic that they can't sit through a full hour of therapy, whether it's PT or OT or vision therapy. And so their funds and their energy just gets depleted so quickly. And so my goal here is to do the group sessions again. For one, I think it's so important for these patients to not feel alone and to realize that there's other people that are going through this and having the same
Mhm.
symptoms, especially when they've been told by so many providers that, hey, like, you just got to figure it out, right?
Mhm.
But the other goal is to like just teach little skills to help them know where their limits are so that they can build their stamina, so that they can last through the full therapy sessions so that they can really start to get better again.
I love that community aspect. And,
Thank you.
everyone is dealing with something.
Yes.
Our daughter, she has a port wine stain on her face. It's a birthmark.
Mhm.
And to kind of reduce the look of it, because it is kind of really just cosmetic, we have to have it treated at Children's, and she gets laser
Mhm.
treatments, and it turns this like dark purpley color. But we just were telling her, everyone has something going on, whether
Yes.
it's physical that you can see, mental or emotional, we're all going through the same
Mhm.
thing. So the fact that you kind of bring people in community together that are all going through similar things is just wonderful. That's great.
Thank you.
Okay, anything else that you want to make sure that we discuss or want to highlight about your office when it comes to brain injury patients?
I think it's not just brain injury patients. I think if you are struggling, with the dizziness or nausea or brain fog or just feeling like you can't focus when you have to read or do anything visually demanding for long periods of time, I
Mhm.
think we can all help with that. There, with all the new like inflammatory conditions that we're discovering, like dysautonomia and long COVID and things like that, I find that it all kind of we can all treat them very similarly. And a
Mhm.
lot of it just comes down to stress response and how to handle stress better.
Can you explain how our nervous system specifically impacts the sympathetic response and it affects also how we see?
Absolutely. So when we are stressed, whether it's, emotional stress, physical stress, mental stress, our bodies respond as though like a lion is coming after us, right? And so
Mhm.
that fight or flight response is really going to change how we focus and use our vision. When if there's, a predator coming, we're not going to be like focused on the fine details, which is what we're doing most of the time in our daily lives now. So if we're in this constant stressed state, it can get really hard to process information. We have something called our functional field. So when we're looking at something centrally, 20 degrees outside of central, we're able to process that information. But when we're stressed, that really collapses. And I'm sure we've all experienced it where we're like really stressed. We're, driving somewhere new, finding that place, and everything just collapses. And all of a sudden you're like, whoa, I didn't notice that pedestrian there, right? And
Mhm.
so when that functional field is so collapsed, it can really affect how we're able to take in information. The other thing that happens is that our pupils dilate. So when there's light, our pupils are supposed to constrict to limit how much light comes in. But when our sympathetic response is to dilate the pupils, and that can lead to light sensitivity, which a lot of like brain injury patients notice. So kind of going back to the binocular vision disorder piece, when our functional fields are, oftentimes in a brain injury patient less than 1 degree, if each eye is only seeing within 1 degree, there's no overlap between the two eyes. And so it's really hard to know where the eyes are aligned. And that kind of fuels that binocular vision syndrome. And so someone who is more stressed is going to have more symptoms than someone who's managing their stress a little bit better.
I'm just even thinking too, like reading emails. Things like, just doing daily tasks, like it takes you so much longer when you're stressed. You're like, what did I just read? And like it, you're just not able to kind of see the full like
Picture.
sentence. And then you're kind of like, okay, but your brain is just, and your eyes are kind of all over the place. So everything just takes so much longer.
Exactly. And that like input just takes so much longer. And so then there's that brain fog because you're not able to process. And then like the output is so much more effortful too. And so you can imagine if it's hard for us as adults, like for a kid that's struggling in school, like that's why they're so tired. And that's why they act out when they're at home, is they just don't have the energy to do those basic skills that makes all the cognitive processing so much harder.
Yeah. Oh, poor baby. I know. You're just like, leave me alone. I need my space.
Yeah.
And our efficiency goes down in the workplace, and yeah, you're just on the struggle bus whenever you're stressed. I was also talking with a friend, and she just, she's like, I feel like I need a break from life, which unfortunately just comes at you like that. But
Right.
it also, she's like, it wasn't until I started actually recovering a little bit that I noticed other parts of my body finally relaxing.
Yes.
So maybe you'll start to see that. But, what's your advice then for people who are just really stressed?
Right. It's just taking the time to really figure out what works for you. I love that you bring so many different providers into your podcast, because what everyone needs is a little bit different. And that's one thing that is my goal as well. Is I feel like I have this unique connection to different providers that have very unique services. And when a patient comes in, I just love taking the time to like listen to them and understand, what they've tried, what their passions and values are, to help hopefully like make that connection for them to find someone that they really need that can help them, whether it's me or somebody else. And I think honestly, a lot of times it's the same repeated things that you need to manage your stress, right? Sleep, breath work, breathing, and then just taking the time to be present. And so I heard this really great saying that, anxiety is like fear for the future, and depression is the inability to let go of the past. And that's why the present is so important, because, if you are present, then the depression and the anxiety can, lessen.
Yeah. That's a really good quote.
Yeah. And so it's really amazing too, when you like take the time to breathe. If you kind of picture the space and notice how you feel you are in the room that you are in, and then close your eyes and do some deep breaths, whether it's like box breathing or different levels of breathing. When you open your eyes, notice that space again. I can almost guarantee most of the time that the room will feel bigger.
So in addition to, finding those stress techniques that that work the best for you, do you have any other things that you like to talk to about with your patients in terms of, a supplement that might be good for the eyes that's, stressed out, or just how to take care of our better all like health of our eye?
Yeah, absolutely. So I think it was Dr. Kennedy that kind of mentioned the 20-20-20 rule, just making sure you're looking far away. We're not made to look at a screen or up close in any form for hours at a time. And that's what we spend most of our day doing. So really just taking the time to look far out in the distance, look out a window as far as you can, making sure you're blinking so that, you're refreshing the tears. Supplements are great in terms of like antioxidants like lutein and zeaxanthin. Those are the antioxidants that protect your macula against macular degeneration. But there's studies that are showing that it may be deposited in your brain as well. And early studies potentially saying that it might be deposited in your adrenal glands. So just a lot of exciting new research. I think most importantly for me is I love talking to patients about how I can use different glasses or different prescriptions to help them in where they spend most of their time. Glasses are kind of like shoes. I tell people, you have your most comfortable pair that you can wear for most anything. But if you're going for an avid hike or doing something different that requires specific support, you just do better and function better with that. And so same thing with your glasses prescriptions. We can tailor that to you and your needs.
I love that.
Yeah.
Our glasses are like our shoe, you just different terrains call for different shoes and what you have going on.
Yeah, and different tasks, you just need different support.
What would you say like the average person probably needs? Like how many different types of glasses throughout the day, depending on what they do?
Yeah, probably like just two. I'm thinking most of us do work in front of a computer for most days. And, a lot of times, especially as you're, in your 40s and higher and you need a little bit of help seeing up close, most people have the progressives, but the area in the computer area is so small that having a specialized design for the computer, whether it's another pair of like an office progressive or just single vision computer glasses, can make a difference in your comfort and fatigue at the end of the day.
And cause your eyes less stress, right? Because
exactly.
If one thing is only really good for this purpose, and then you're kind of forcing your eyes to work with it outside in this different environment,
yes,
it's going to cause extra stress and strain on the eye.
Exactly.
So it does. Your name, it has the word boutique in it. So do you sell glasses in there?
Yeah. So we carefully chose independent frame lines. We just really wanted to support these great artists and craftsmanship. And so we have independent frame lines that are very unique, and they make glasses in small batches. So you're not going to find the glasses that everyone else is wearing. We even have one line that is completely customizable. You can choose your own colors and temple styles and everything. So it can be completely unique to you.
Oh, that's fun.
Yeah.
I love that. So if you're looking for some new glasses and you don't want it to be like the person, the neighbor down the street or anything like that,
Exactly.
go check out and see what kind of glasses and options you have, different frames that you all have as well.
Thank you.
Okay. Congratulations again on opening your new clinic, Peak to Peak Vision and Boutique. Can you tell us a little bit about it and where you are located and what makes it unique and special compared to other vision clinics?
Absolutely. So we're located in Old Town Lafayette. Again, when you come in, we really focus on truly understanding what your visual needs are and giving you the knowledge so that you can make confident, informed decisions for your own eye health and visual wellness. And so we just really want you to be able to see better and thrive in everything you do. And the other thing that makes us unique is we do have that workshop space, not only to have community built classes for people to, improve their visual skills and learn about it, but also to collaborate with other local providers and just share what other people have to offer.
What other providers do you envision collaborating with?
Yeah, so Dr. Michelle Green, whom you've had on the podcast,
she's a chiropractor.
Great, yes, and we connected on scoliosis and how vision can play a role in that, and then also like Dr. Nichelle Garul, we've kind of connected about how we can talk about primitive reflexes are so important in child development, and then building on those visual skills afterwards as well. And any other providers that you feel like they can collaborate with us, I'm happy to connect with you. And then I'm happy to kind of share some other connections with you too, Lauren, because they might be good connections.
Yeah, bring them my way and we'll see if they'll be a good fit for the podcast. But I
Yeah.
love people who are like willing to like collaborate. It's always better doing things together. It's so much fun.
Absolutely. We definitely don't, we're not isolated in what we do. And there's time and places for different therapies and treatments. And so if we can just all work together, I think we'll get everyone being better and thriving.
Yes, definitely takes a whole village to like,
Yes.
and all of us are so unique. I think I've mentioned this before on the podcast, but we are all have our own unique needs especially when you have a family, your
Mhm.
spouse's needs look different than your own. Each individual kid has their own things going on. So it's
Yes,
really nice to have that whole village to help with all of that.
absolutely.
Okay. Do you have any, so we'll release this episode, like I said, end of December, beginning of
Okay.
January. But do you have any upcoming workshops, community events, or educational sessions that the listeners might want to know about as we head into the new year?
Yes, so I'll be launching the kindergarten readiness class soon. We'll have several of those throughout the year. So just kind of keep watching our website or Instagram page for updates on that. We'll also have our traumatic brain injury recovery sessions. And then every month we'll have some workshops as well. So, just keep posted on our Instagram. We don't have anything planned quite yet, but those are some priorities that we have.
What does the kindergarten readiness program look like?
Yeah, so I'm trying to decide if we want to do like 1 week of sessions where kids come in for a couple hours every day for a week, or if we
Mhm.
want to do 6 weeks of weekly sessions um, at just 1 hour each time. And we'll just kind of work on learning how to navigate space and being aware of our own personal space. A lot of times kids don't know where they are in space. And so that's why they can't sit still in school. They have to constantly move in their chair to like get that feedback in their bum that they're on the chair.
Mhm.
I worked with a kiddo who didn't have any friends because every time he put on his jacket, he like whacked 3 kids in the room. And once after, working with him a little bit on his visual skills, he knew his space and he wasn't hitting people anymore. And so he finally had some friends. So just little things like that and some early eye movement training just to prepare them for kindergarten so that they're ready
Okay. For reading and
for reading.
interacting with classmates, all the
Yeah, and just, surviving a full day of learning.
and it's not just for kids with glasses or a prescription,
No, it's for
right?
anybody. It's our eye movements aren't our reading eye movements aren't developed until age 6 or 7. And so when we're pushing kids, the academic demands that we are pushing on them these days, it can be challenging. And so giving them a little bit of a boost before they go into kindergarten can hopefully help them.
Mhm. Dr. Yeung, thank you so much for joining me today on the Erie Wellness Podcast. It's been a wonderful and insightful conversation. I love learning more about binocular vision, how brain injury patients can be impacted by vision therapy, and how stress can impact the way we see the world, literally. And it's also wonderful chatting with another local mom and business owner who's passionate about helping others in our community. Congrats again on opening Peak to Peak Vision and Boutique. I can't wait to see all the ways that you continue to serve families here in the Erie and Lafayette area. If you are listening and want to learn more about Dr. Yeung, be sure to check out Peak to Peak Vision and Boutique. And thanks again for tuning in. We'll see you next time on the Erie Wellness Podcast.
Thank you so much, Lauren.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time. That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.